Here we go. Good afternoon, everyone. Welcome to today's session on data-informed supervision for supported employment and supportive housing. My name is Amy Banco. I am a faculty member at Rutgers University in the Psychiatric Rehabilitation and Counseling Professions Department. I work specifically with the Integrated Employment Institute, where I provide training and technical assistance, conducting research, and course instruction on the topics of supported employment and supported education. My passion is helping people with mental health conditions to achieve meaningful recovery life goals within those amazing social determinants of health, like education and employment. I was a supportive housing provider prior to coming to Rutgers and prior to working in career services. I did that for several years, doing supportive housing, independent housing support for individuals coming out of New Jersey's Trenton Psychiatric Hospital setting, which I was just as passionate about in helping people to gain independence and integrate into their community. I'm really excited to be here with you amazing providers in Washington State with FCS programs, helping all those folks in your state achieve those similar meaningful recovery goals. Just as a gentle reminder, today's webinar is hosted by DBHR through the Washington State Healthcare Authority. Today's training is intended to be interactive. We highly encourage folks to ask questions, participate throughout the session using the chat feature. Please note that the use of automated note-taking bots, similar tools during Washington State FCS events or meetings requires prior approval. Unauthorized use of such tools is prohibited to ensure the privacy and confidentiality of our attendees in today's session. Any recording that is created through AI is not recognized as an official recording of this session, and we reserve the right to exit trainees from the training if they are using AI to take notes without prior approval or using AI to record the session. Additionally, materials used from today's session, the recordings, PowerPoint slides will no longer be emailed to participants. Materials are going to be uploaded in the chat at the end of today's session. So I will make sure that folks at the PowerPoint, handouts, as well as additional tools, I believe I'm using a Google link for an activity, and then the recording of today's session will be available on the HCA FCS channel, which is Foundational Community Supports YouTube. And you'll see that posted approximately 2 weeks after the session. Looking at today's topic, we are going to be defining and reviewing data-informed supervision. We're going to identify benefits of integrating data-informed supervision into your supervisory practices. And we're going to explore approaches for tracking employment and housing service data, as well as do like a little bit of a barriers assessment, right? What are the barriers to engaging in data-informed supervision? I know from prior sessions for our learning community for supervisors, this learning community, that sometimes folks are attending in the capacity of a supervisor. Other times, folks may be attending, anticipating that they'll be in a supervisory position soon, right? Looking for that ultimate promotion into a supervisory role. So however you are attending today's session, whatever your role, whether you be like a supervisor, right? You're already engaged in supervision and providing supervisory support to staff, or if you are attending supervision as a supervisee, looking to become a supervisor, reflect on your practice and your current role and or your future role as we engage with the material. Okay, so when we think about data-informed supervision, what is that? What do we mean? Different types of service modalities, right? Whether we're in supported employment, supported housing, assertive community treatment act, if we are in ICMS, integrated case management services, right? All these different service modalities require tracking of different outcome indicators. We know that employment services, common data points might include, right, metrics Might entail number of job development outreaches by the practitioner, hours spent in the field meeting with job seekers, number of interviews that a person may um, go on within a span of time. We know that for housing and supportive housing providers, people might be tracking length of time housed, length of time unhoused, time that a person may have experienced a crisis or hospitalization. And all of those things can be useful, right? Um, Helping a staff person and supervisor, leadership, program administrators to understand what's going on within service provision. A step beyond outcome tracking is that data-informed supervision, outcome management, which is referring to aggregating, analyzing, and interpreting that raw data. And we do that in the aim of improving our practices, enhancing service provision, and hopefully goal attainment for people and services. Use of outcome data at this level can lead to more effective and efficient ways of serving people in our programs. And right, that's kind of our aim is enhancing the quality of our services, that continuous quality improvement. So let's think for a minute. All right, before we get into specific metrics, let's start with your experience as supervisors or supervisees. We often talk about what data we should be using, but when in reality, we know we are already using data every day, formally and informally. And so the question is not whether we use data in supervision, right? It's are we using data in supervision intentionally? So take a moment and think about your current experience. What data currently informs your supervision of staff? Or if you are a staff person being supervised, what data informs your evaluation of your work, right? And what you share with your supervisor. More specifically, I want you to think about when does data feel helpful or unhelpful in your work? So think about the data that you currently use and what data feels helpful or unhelpful in your work. Take a minute or two and put it in the chat. What data feels helpful? What data feels unhelpful? What do you find most useful? Okay, I see some things coming in. Length of time until housing secured across participants. Yes, Anna. Okay, thank you. Felicia, housing logs, employment logs, referral trackers, active client reports. Excellent. That's a whole list of good data points. Note taking. Yes, Tamara, we can learn so much from a well-developed progress note. ECRs have a lot of unique features where we can even toggle certain things, whether a certain service occurred, and that ECR can aggregate that data in those progress notes. Housing rights, length of housing, productivity numbers. Oh, I wonder what productivity numbers are, but I like I like the sound of that, Eric. Thank you. Action plans, housing logs, case notes. Again, Jennifer is pulling in those progress notes as rich data reports where we can get some good qualitative data as to what happened in a session or some quantitative data if they have those checkbox features for service provision. Um, nice. And I like the point of the action plans, right? The goal planning. That can give us some really good information in terms of progress on goal plans, the type of goals people are setting. Does it include community integration, wellness, um, goals and objectives. My schedule calendar, which is viewable to my supervisor, my documentation. Yeah, our schedule, the calendar can have a good amount of information to share in terms of how time is being spent, Deborah. I love that. Documentation, care plans. Yeah, so you're thinking like Jennifer, those action plans can be a great source of discovery in terms of what's going on, right? Is it achieved? Are we marking off that things have been completed, achieved successfully? Have things have been terminated, right? Certain objectives. April, job placement rates. You guys are fantastic. Referrals made, Alicia. Yes, we want to know that, right? How are people getting connected? Connected to what? Connected to whom? Is it community resources, natural supports? Right? How are we helping people to get linked? Daniel, helpful, court hearings, goals, insurance info, contact info, emergency contacts, housing info, last seen date. Excellent. Helpful. Those progress notes. Yes. Housing program available. Yeah. Placement contact trackers, assessments from Lauren. Great. Yeah, we can learn a lot from what we evaluate and what is recorded in those assessments. We are fee for service and out reimbursement rate. It's extremely low, so we have to track production numbers for billable units. Yes, Eric, you bring up a great point, and that goes to our why. Why? Why are we doing this task? Why are we i- looking at data, and why are we looking at outcomes? And sometimes it's very much tied to funding. Yeah, excellent. So we have a really good understanding of data that can be helpful and how to incorporate that into our data-informed supervisory plans, where we can intentionally pull from the data that's already being collected, right? And that's going to be a big help as you craft a plan today, an action plan of what you want to do, maybe continue doing, right? That you're currently doing and doing well, and maybe some new opportunities to include some other areas of metrics to inform your staff professional development, your own professional development, your program development. Love it. So when we think about data, what is data, right? What put in the chat, what is data? When I say data, you say what? What comes to mind? Raw facts and figures. Yes, Tanya, tracking, documentation, raw numbers, results, yes, outcomes. Allows professionals to track and monitor outcomes. Exactly. This is our source of information. It is a raw figure, right? It could be related to outcome. It could be related to documentation. It's something that is observable. It can include, patterns. And ultimately, it can weave a story. That's what we want. We want to take those raw data points and weave them into the stories. In many programs, we collect a lot of data, but we don't always, I should say, don't always transform it into something that is usable. And so data is our first piece of information. It can be a contact note, a missed visit note, number of employer contacts within the last week or month, a record of a lease violation. But data alone does not tell us what to do. It simply just tells us what happened. We want to take that data and move it into information. And information is defined as what happens when that data is organized and given structure. So instead of an individual missing a visit in the ECR, we might see an aggregated pattern of disengagement as we transform that data into information. We might see instead of one job contact note, we see time to first employer contact across someone's, whole caseload list. And instead of, housing, we look at, one piece of a note or a report about a psychiatric crisis. We could see as we aggregate that data and turn it into information, maybe that crises, the frequency of crises over time or severity, right? This is where supervision often begins, but this is not where it should end. We need to translate that information those patterns that we're seeing into that knowledge. And that's when we take information and interpret it, apply it to context, so that we can ultimately guide it to our own action, support our plan of action, if you will. So this might sound like, if an individual hasn't had contact in 2 weeks, how are we moving forward? What are we doing with that staff person to explore barriers that might be present, challenges, different ways of outreach or engagement? If a worker has low um, employer rates, right? Low employment rates for people, right? We might look at, what does that staff person need in terms of supervision, individual supervision? Maybe they need in vivo coaching, where we go out in the field and support them with job development, developing interview skills with people in service, right? This is where we take those data points and the story that we've developed and find solutions, giving it meaning and context and actively trying to find resolutions. So as supervisors, our role is not just to review data, it's to help staff move and transform data into that knowledge. Unfortunately, if we stay at that data level, we risk compliance-driven supervision. And then if we take that data and transform it into that narrative, that story with action plans, we're really engaging in kind of, I think more intentional supervision, enhancing our recovery-oriented services and supports, really being psychiatric rehabilitation focused, right? Making sure that people have good quality evidence-based practices to support their wellness goals. So thinking about your own supervision practice, are you primarily reviewing data, looking at numbers, notes, tasks, right? Are you helping staff to interpret that information? Or are you co-creating knowledge, right? Looking at meaning and strategy and next steps. Put in the chat. Are you just primarily reviewing data? Are you focused on interpreting information? Or are you in that step of building knowledge and action steps? What does that look like for you? Where are you currently at? Where do you spend your time? Yes, Eric, doing all three. That's great. And it is a process, right? You have to start at that step of collecting the data. Yeah. So everyone so far is acknowledging that you are really moving quite intentionally throughout this process, always in progress. I love that. Yes, we're always learning. I too feel like I am a forever learner. All three, it's daily collection of data. Yeah, Felicia, we can spend quite a bit of time on that data collection process. It can be challenging to look at efforts to streamline, and that can be really dependent on, do we have paper records, ECRs? If we have ECRs for data collection, what's the reporting feature like? I remember meeting with the IT person frequently to look at new ways to collect data points, right? How could we change progress notes so that there were toggle features that could be aggregated in the back end to make, job development logs very easy, right? I could just want to run a very quick report and I could see how much time someone spent job developing, but not everyone has those readily available features. Data that is quantitative and qualitative. Yes, Alicia, that is so important. We need both. We need both to support our work. And in fact, we're going to be running a three-part series starting in April. It's going to be April, May, and June, where we're focusing on building out satisfaction surveys, best practices in developing satisfaction surveys for our programs. We're going to learn about how to develop them, best approaches in creating them, best approaches in administering them, what we do with the data when we get it. And that third session of that series is going to be about supporting in a roundtable um, your own satisfaction survey development. We'll do a 90-minute session where we're just troubleshooting and walking through that process for everybody. And so satisfaction surveys are a great way to get some good qualitative data or even focus groups. So as we move forward, we're going to focus on how do we ensure the data that we collect supports knowledge building, supports this step leading to action and resolution, right? So that supervision leads to hopefully enhanced outcomes in employment, in housing, as well as recovery. When we think about today's session, it's always important to determine rationale, right? Why do we do something? Why does any of this matter? Because if data is treated like just another task, right, or if it feels like it's this heavy task that's cumbersome and unimportant, right, staff will certainly take on that mentality. And so, first step when you are working with your staff is really to provide that clear rationale. In your own words, why does it matter? Why does this matter? What do you think, Nicholas, for reporting purposes, for funders, future grant opportunities? I love that. Yes, we have to provide information to our funders. That shows real impact. Yeah. We can think, like April saying, we could think we're doing a good job. We can say, what we do makes a difference, right? Oh, we're getting some really good outcomes, but that's a bold statement. We need some data to back that up, right? We need to get some uh, collated information, aggregated information to determine, right? Are we making an impact? Professional growth, I love that. Provider turnover. Yeah, yeah, James. Right? We have a lot of provider turnover, and so it's important to know what's been happening, how to get the understanding of, services and outcomes. We can also get a better understanding of what's going on for our staff, what could be contributing to that turnover. Maybe people are not feeling as confident in service provision. Maybe they're struggling in some areas. I remember one staff person that I supervised that was really struggling with engagement, and they felt ineffective. And I didn't realize it, but they were like this close to leaving because they were really struggling. So we did some tailored supervision. We paired them with another staff person who had some really great strategies on getting people engaged, working with readiness, motivational interviewing, right, to build that therapeutic relationship, to build connection. So yeah, I love that. Improves outcomes, funding, and shows that we're actually, doing the work and the impact that it's making. I love that, Danielle, that we're making an impact, right? We can't make a bold claim without backing it up. I always tell my students that if we are writing something, a report paper, and we are stating something as fact, where is that citation? Where is that information? How is that supported by the evidence? Is it supported by the evidence? Providing quality services, keeping staff happy. Yeah, absolutely. Staff wellness is just as important, right? Making sure that our staff are managing their own wellness is critical. Ensures accountability, yes, and quality. I love both those, right? That people can take accountability and pride in the work that they're doing and find ways to potentially improve. And data itself does not improve outcomes. What we do with that data as supervisors, as organizational leaders, right, helps us to improve outcomes. And so at its core, data allows us to, people said it multiple times in the chat, demonstrate impact, to demonstrate outcomes. In FCS programs, this means being able to answer, are individuals obtaining and maintaining employment? Are people remaining stably housed? Are folks in our services progressing in their recovery goals? Without data, our work is invisible. With data, we can clearly show movement towards that recovery, progress over time, the value of the services that we offer. In this ever challenging landscape with funders, we need to demonstrate our value, right? That's so critical. And that goes hand in hand with data-informed supervision helps with sustainability. In systems like FCS, funding is increasingly tied to outcomes. They're outcome driven. And that means that programs are asked to demonstrate, right, our employment outcomes, housing stability, engagement over time, wellness outcomes. And if we can't show these outcomes, right, clearly in a very easily readable format in reports or narratives, programs risk losing funding. And that's not because the work isn't happening, it's because the results aren't being aggregated and captured in a way that people can easily access them. And that's a shame, right? Um, and ultimately, when we think about why this matters, I think this is one of our most important points, and you guys said it in the chat, right? Data improves services. Data improves services, right? When we take that data and inform our actions, our training, our supervision, it hopefully will improve those services. We can identify gaps in staff competencies, gaps in the services that we provide. Maybe we can track uh, and identify earlier, risks like disengagement, housing instability. We can hopefully tailor supports to a person's individual needs, and strengthen our recovery-oriented outcomes, right? And another thing that I think is important to consider, and let me know if this resonates for you, prevent burnout, expand capacity for services. Yes, yes. We can easily see as we're tracking data and turning it into that knowledge, right, an action plan, what our capacity is, where we're at, and if we can expand for sure. But let me know if this resonates with you. Most SE and SH providers do not have formal training. They don't have certifications in employment services or housing services. They're not licensed in these domains. And this can often mean that people are coming in and learning this field. They're learning these job tasks. So these folks need effective clinical supervision to understand this evidence-based practice, to know how to provide these services to fidelity, right? We know that the more a person provides services to fidelity, the better the outcomes, potentially, the better the outcomes are, right? And so we know that effective clinical supervision can account for up to 16% of the variance in people's recovery outcomes. Clinical supervision, supporting individuals, staff in learning those job duties, learning these evidence-based practices, can support those recovery outcomes. So we need data-driven supervision to improve the quality of service provision in these evidence-based practices. And I think we also need more research to better understand, right, the mechanisms involved in this supervisory process. But I think that's always an ongoing process. Is there a way to get certifications or know who provides training? That's a great question, Lauren. So there are for supported employment different certifications available. The folks at the Individual Placement and Support IPS Institute or Center, they offer a certificate as a supported employment specialist. And I believe you have to take an exam and pass it with a certain score. I don't think that there is a certificate specific to supportive housing. There are classes. There are classes at universities in these two evidence-based approaches. And the reason I know that is because the classes are offered at Rutgers in the Department of Psychiatric Rehabilitation and Counseling Profession. So I actually teach the supported employment class, where folks get a full semester of how to provide supported employment services according to the IPS principles and get to, do all the different activities related to IPS services. And I myself am certified as an IPS provider, as a supported employment specialist. And then we have a supportive housing class as well that runs in the summer. I believe we're the only university that offers undergraduate courses on these two topics. So you guys made this great argument as to why this matters. If we're not measuring a process, you don't know what you're doing, right? Someone said we have to demonstrate. We have to demonstrate impact. If we don't measure, we don't know. We don't know the impact, right? And if we're not measuring, we can't improve. We can't enhance. We can't, someone mentioned accountability. We can't emphasize that accountability or explore it. And if we're not measuring, we're operating, unknowingly. We're operating unknowingly and therefore at risk for delivering ineffective, wasteful services at best. Oof, that hits hard. If we're not measuring, we're operating unknowingly, and therefore we're at risk for delivering ineffective and wasteful services at best. Very small pockets of money are put aside to support people who have um, mental health conditions receiving services in the public sector. And we want to make sure that that money is being put to good use. And so our due diligence really is measuring, right, what we do and enhancing upon that based on what the narrative, that storyline is from the data. So when we think about supported employment and supportive housing data tracking, we've been doing it, right? We've been participating in maybe fidelity reviews. Maybe we have monthly, quarterly, annual reporting. Maybe we do have some satisfaction surveys, right? We have been immersed in this process to some extent. And so now we want to repurpose some of those processes to inform our individual and team supervision. That's the ultimate goal here. How are we taking what we're learning and bringing it to our supervisory meetings? One-on-one, if the concern, area of need, area of acknowledgement, that's important. We want to acknowledge too. We talk about being strength-based in our service provision. We should be strength-based in our supervision. And so when we are looking at the data and turning that into knowledge, making our narrative, our story about what we're observing, definitely find your area of strength, staff's area of strength, the team's area of strength, and then the areas for development. But yeah, we want to see how do we bring it into individual supervision, group supervision, right? How does it inform um, larger agency-wide initiatives, right? What do we do with that information? So now that we've kind of talked about data-informed supervision, talked about the definition, the rationale, um, what do you think would be important to maybe include on your list of metrics? What would be important? You can put it in the chat. What would we want to know about? contact frequency, work history barriers, Felicia tracking staff training and certifications, goal completion. Love that. Are you guys able to see the Excel spreadsheet that I put in the chat? How odd. Okay, I put in a sample outcomes tracker for supported employment, and I'm putting one in for supported housing. So we can be, um, you know, oh, you don't see it. It's a document. It's an Excel spreadsheet document. It should be like a little icon, a green icon. Hmm, I'm so sorry. Let me see if I can try again. I can always share the screen. Saying network disconnected. Click to retry. I've never received that message before. I'm so sorry, guys. Okay, I'll share screen in a second. But this is an Excel spreadsheet that gives an example of some data points. Um, and you want to be intentional with your list. More data isn't always better. We want to be tracking things that we're going to utilize, tracking things that we need to provide to our funder, tracking things that would tell us about the quality of service, um, metrics that are going to indicate whether someone is attaining their recovery goals, things that are intentional. If the data tracking list is long, it's cumbersome, it's not being used intentionally, right? If people are tracking things and nothing is getting done with it, all of those issues are going to be counterproductive to the goal of data-informed supervision. And so you might consider, right? Do you want to know about interviews? How many interviews individuals go on? Job offers received? Number of days from intake to an interview or to see an employer, right? Number of days from job search to employed, job placements, employment status, employment tenure, percentage of people employed, percentage of people unemployed, educational goal attainment, hours conducting job development, right? Things that are going to be meaningful, purposeful to inform how you are training, mentoring, and coaching staff. One of the worst things that we can do is flood a tracking sheet with items that we're not going to be following up on, that are not going to be used to inform team supervision, individual supervision, follow-up conversations. If it's something that you're tracking and you never have a follow-up conversation with staff about, that's an indicator that that item might not be needed as a part of your tracking sheet. What about SH? Any new ideas about data points to be tracking? Housing status at enrollment versus discharge? Absolutely. Demographics, background? Yep. People housed, applications completed, length of stay, how long they were houseless prior to being housed, time to get housing, number of times contacting the individual, staff engagement with housing providers, where a person's housed, market rates, all great examples. Yes, we want intentional data points, right? Number of housing placements, number of days from intake to housing placement, number of returns of people being unhoused, housing retention, housing status, stable, at risk, unhoused, or unstable. Percentage of people stably housed, percentage of people experiencing housing instability, eviction notices, right? Lease violations, maybe even hospitalizations, right? If you're working with folks that are coming. I know that was something that I tracked when I was working with the Trenton Psychiatric Program, the SH program that worked with the long-term inpatient hospital. And so we were looking at who had readmissions. And we can also consider things like community integration or linkage. Someone mentioned this earlier. Number of connections to community resources, participation in community activities, right? Social support engagement, engagement with family or peers, natural supports, transportation access, usage, linkage to primary care, other behavioral health providers. Or, and I love this idea, I'm not sure if this is something that comes up for you folks. Someone earlier said checking those recovery plans, those action plans, right? To see percentage of individuals achieving their self-identified goals, progress towards their recovery plan, or maybe even alignment of services with their identified objectives and preferences on that recovery plan. But again, we can create Excel spreadsheets, we can have back-end reporting from our ECR, whatever we choose to do, however we choose to set up our outcome reporting. Maybe it's, a Qualtrics survey, a survey monkey survey, or a red cap survey, whatever your agency has access to. We just need to make sure it's a defined process, that it's accessible, and whatever is on that reporting form is going to be used meaningfully. That we're taking it, looking at it in terms of each staff person, aggregating it for the team to look at team trends. I remember there was one point in time where people were struggling. Folks across staff were struggling with job maintenance. They could go on those interviews, they could get the job, they could show up on the first day, but that job tenure piece, that sustainment of the job across staff was really low. And so we had targeted team and individual supervision and trainings to build job coaching, on-site job coaching and off-site job coaching for people who did not give consent for us to go on-site with them. And so helping that person, when we were meeting out in the community, to do some tailored supports, right, around figuring out job tasks, asking for feedback, connecting with colleagues, asking for more supervision or mentorship, etc. But the only reason I knew, right, that this was a team-wide issue was because I was able to look across the reporting forms to see that a bunch of people were losing jobs. We had very low job tenure across staff, right? That's indicative when we see that piece of everyone on the team, most people on the team, that's a team-wide issue that requires a team-wide solution in addition to individual supervision. Unfortunately, I can't get those data tracking forms into the chat. But maybe I can share. Let's see if I can share my screen. This is just a simple example of a tracking sheet with a bunch of sample drafted tracking categories. Right, we can use a person's ID number, initials, right? These categories being the job seeker. A staff person would have their own Excel file. Each staff person would have their own file. Staff A, their own file, staff B, their own file, and they would track the people that they're working with, the date that they were referred, date of intake, job search start date, first employer contact, first interview date, job offer date, job start date, their current employment status, days to job search, right? Days to interview, days to start job, job title, employer, hours per week, hourly wage, whether they did benefits counseling, employer contacts, interviews for the month, job offers, applications, right? We could be as creative as we want. We just want tailored data points that we're going to be using that would be intentional. And then a sample version of a data tracking sheet. I guess we're going to have to email these out to everybody. My apologies. It's just not working. Um, would look similarly, right? The housing status, days housed, lease status, eviction risk, um, rent, if you're looking at things like ADLs, wellness or self-care, household management, if you track that, community activities, community integration, employment status, education status, connection, goal progress. You can be, again, be as creative as you want with individual tracking. I have a monthly summary and a data dictionary looking at, right, what those fields mean. But again, this is one method that doesn't require a fancy ECR, that doesn't require, to have IT work on a back end solution with the ECR. This is very simple. And you, as a supervisor, can kind of create what those columns look like, the frequency um, that people fill them out. Maybe they come to team supervision with them filled out. Maybe they come to individual supervision with those things filled out so that you guys can talk about those outcomes intentionally. So we have our plan in place as to how we're tracking the data. Now what, right? What do we do with it? Well, one, we want to aggregate our results to look to see what is the data signaling, right? Is there progress? No progress. Did outcomes decline? Is there any pattern? Are there outliers? And then for step two, once we see what the data is signaling, we need to determine the level of what we're observing, right? Is it with just one individual that a staff person is working with? Is it a lot of individuals that one person is providing service to, right? Meaning a pattern. Or are we seeing a pattern across different staff, meaning a team level, right? So we have individual, we have staff, and we have team. If we see that it's at a staff level, right, maybe the concern is a skill issue and we need some in vivo coaching. Maybe that staff person is having, a challenge where we need to support them not only with skills teaching and in vivo coaching, but supporting them with that accountability piece. If it's a documentation issue, maybe we support them in doing some work sample reviews, meaning we, do like audits of documentation in preparation for supervision. If it's a team level issue, we might address knowledge gaps. If there's inconsistency across the team outside of knowledge gaps, maybe we need a better understanding of our standardized practice policies, procedures. Or maybe it's a systems barrier and we need some workflow changes. Right. So we need a clear and structured process going from we've reviewed that data that we tracked to using it intentionally, interpreting it, making decisions, implementing changes, evaluating that impact. And what we're really kind of alluding to right here is continuous quality improvement, or what's frequently referred to as CQI, continuous quality improvement. And that ensures data just doesn't sit in a system, it changes what we do, right? Um, so CQI is an ongoing structured process to improve our outcomes, whether employment services or housing services. It strengthens supervision and staff practices. It ensures that the data is used to guide action, right? That it's not just sitting somewhere collected. Um, and so CQI connects directly to, the whatever employment outcomes we're tracking, housing stability and independence we're tracking, even the metrics of recovery attainment, right? Recovery goal attainment, whatever that those data points may be, we can use a CQI process. So step one is plan. We identify the focus and the strategy, define what you want to improve and how you will measure it. So that's going to be step one, planning, using that time to build out the metrics that you're going to be tracking, creating your own Excel spreadsheet, right? What goes on that? Who's tracking what? How frequent? So we might look at job placement and wanting to increase job placement. Maybe that's our objective, increase job placement within 60 days of intake. Maybe it's reduced missed visits in supported housing. Or maybe in supported housing, we want to increase community integration activities. So we need an objective, we need to develop a plan, right? And we can ask ourselves, what is the problem or the gap, the knowledge gap? What outcome are we trying to improve? What data will we use to track progress? Who's responsible? And, for, what time? What is the timeline? Then we move into do. We carry out the intervention and document what happened, right? We, in this, the do phase, carrying out the plan is having folks record the data, right? We look at our data points. Maybe it's the contact notes. Maybe it's ECR, electronic charting record fields. Maybe it's our Excel spreadsheet. Or maybe it's certain assessments that we do. Someone mentioned the supported housing assessments. Best practice for this, we want to, document to be done, and hopefully if it's, we're looking at progress notes to capture that data within 24 hours. If we're looking at the recovery plan, we want the recovery plan to be done within a certain time frame, right? Following those documentation best guidelines. If we're looking at weekly data points, figuring out like what day are people going to complete those reports that get submitted weekly or monthly, and make sure everyone has those submitted. They're working on them across that week or across that month, not saving the last day to do it. That data won't be accurate, right? If people complete everything on the day before or the day of that it's due. And then we are going to analyze and interpret that data, turning it into meaningful information. What are the patterns? What are the trends over time? Are there outliers, disparities across caseloads, right? Individuals not engaged in job search after 30 days, increased missed visits, stable housing, but person is experiencing, less community integration, right? Low community integration despite service engagement. And so then we can look at those trends during our weekly supervision, monthly team review, right? Whatever the timeline and frequency is in following up. And then the final stage is the most important, right? Using the data to make informed changes. So we can, from that plan, do study, identify what the issue is, what the next step is, who's responsible, right? How are we measuring success? Um, right, what does that look like? And that then starts the next cycle, right? So CQI is really about ongoing learning, improving outcomes, stronger supervision, informed supervision in both individual, in vivo, meaning we go out into the field with the person and observe their work in real time, and also building sustainable programs. So thinking about what we just learned, consider the following. Tanya is an FCS supportive housing specialist reviewing caseload dashboard prior to supervision. One individual, Marcus, shows stably housed for 90 plus days, which initially appears positive. However, a closer look at the data reveals 3 missed visits in the past 2 weeks, recent lease warnings for noise complaints, a report of ADL rating declined, right? No recent community integration activities documented. In supervision, Tanya states he's technically doing well as he's housed. I think he just needs space right now. The supervisor notices that while Marcus meets the metric of housing retention, multiple early warning indicators of housing instability are present. So what do we think the data is signaling here? You can put it in the chat. What do you think the data is signaling here? Okay, I'm seeing staff needs to be trained on how to teach lease compliance. Yeah, so there's something going on there with this concern. And the supportive housing staff just saying they need space, leave it be. There's a missed opportunity there to support that person in their housing services. Misinterpretation of the data by the supportive housing specialist. Maybe the supportive housing specialist is overwhelmed. Yeah, minimal engagement from both parties. I like that observation. The person is disengaging, and the housing worker might be disengaging as well. Interesting. So we can see, right, that there may be some indicators that this person is experiencing some challenges based on the data, right? If we look at these additional data points, we see the missed visits, the disengagement. We see there have been lease warnings, right? That is indicative of some challenges, as someone noted in the chat. The person has subsequently experienced a decline in the care of the home, and they have recently been less active in their community integration activities, whatever they've been tracking. Maybe they're not seeing friends or family. Maybe they're not going to, you know, clubs or associations that they have previously been attending. So we see some signs that that person is experiencing some challenges, and it might be masked by that retention metric. And so the supervisor might take, right, some of this information and explore increasing engagement strategies, right? Outreaches, maybe exploring disengagement in using motivational interviewing. Maybe the staff person is not aware of motivational interviewing strategies. And so there might be some individual role plays, training, in vivo work around that. Someone had mentioned doing some training and knowledge share, skills development around the lease compliance. Or maybe something is to be explored in terms of using MI to assess ADLs and ADL engagement or community support engagement. I see something else in the chat. Yeah, trauma-informed care training. Yeah, absolutely. We can add that as a layer. Maybe the person that is experiencing some of these challenges, right, is going through maybe an increased time of trauma responses. Maybe there was a triggering event, a reminder, an anniversary, right? So we could certainly support this staff person in getting some additional information as to what may be contributing to some of these metrics that we're observing, right? Doing some good ORS communication and finding out additional detail. What about this particular scenario? James is an employment specialist on an FCS SE team. In supervision, he consistently reports strong rapport with individuals he supports. However, the data shows longest time to first employer contact on the team, averaging 45 days, low number of employer outreach contacts, few job interviews compared to colleagues. Documentation reflects extensive engagement and readiness building. And James shares, the folks that I'm working with, they're just not ready to work yet. I don't want to push them too fast and damage the relationship. The supervisor notices that while engagement is strong, practice is not aligned with the IPS principles of rapid job search and zero exclusion. So what are we noticing here? What's the pattern in the data? Is this a skills issue? Are there beliefs or attitudes that are knowledge gap? What are we observing? Nicholas, yeah, beliefs and attitudes on how they engage the work. Yeah, the person who's looking for work. Fidelity training. Yes, knowledge gap on fidelity would educate him that we don't decide when a person's ready to work. The person decides, the job seeker decides. Yes, Felicia. Yeah, there are some significant knowledge gaps here. The previous example that we gave was a an individual, right, concern. This concern is noted for this staff worker, right? This staff worker, their areas of need aren't just centered on one job seeker or one individual in their service. It extends, it's a pattern, right? The data is showing us a pattern, a story, a trend, or a narrative. And we can see, as Nicholas stated, as Felicia identified, that there is some underlying knowledge gap, some beliefs, attitudinal changes that have to occur, right? This might be addressed in individual supervision, supporting this person in getting to understand the IPS principles better, fidelity reviews, right? In vivo supervision. Maybe I go out with James and we do job development together for people that he's working with, the job seekers that he's supporting. Maybe I am reviewing some of those work samples, looking at outreach logs, looking at the progress notes to get some of that qualitative data as well. Maybe I am partnering James with a more senior employment specialist so that James is getting mentored from a supervisor and from a colleague. right? Maybe we're having James watch presentations of um, people employed through IPS services that talk about the value of work, the importance of work, the importance of that rapid job search and placement. So he can see those responses from someone's lived experience, right? Nice. And then our third example, an FCS supervisor is reviewing monthly team data across a combined SE/SH program. The team shows high number of service contacts across all staff and strong documentation of compliance, right? Strength-based, but we're seeing low employment outcomes across the team. Minimal community integration activities documented, and maybe ADL progress inconsistent. In team supervision, staff report, we're constantly busy. There's not enough time to do more. Further discussion reveals wide variation in how staff define community integration, um, and no shared expectation for ADL support. Documentation focuses heavily on contacts and not outcomes. What is this data telling us at a team level? What data is this telling us? As a supervisor, what do you observe? Team needs unified goals and outcome education, more focus on process than outcomes. Love that. Anything else coming up? Not following the person's goals during appointments. Yeah, that could absolutely be coming up for some of the staff. Refer back to care plans. Yes, Lauren. What do those look like? Yeah. So this team, right? This is a team-wide issue. We want to know more about what's going on with employment, right? Are those services being provided? Folks are saying they're constantly busy. What does that look like, right? Where is the time going? How is that time divided? Are employment services being provided? I often would hear from SH providers who also do integration of SE that they just didn't have time, for the SE services or supports, right? And so if folks weren't intentionally carving out that time to do SE, it always kind of got pushed to the back burner, right? So maybe there's a need for addressing knowledge gaps, right? Unclear definitions of outcomes or unclear processes in terms of how people should spend their time. Definitely some practice inconsistencies, maybe some workflow barriers, policy or system-wide barriers. And what we could do is team supervision could focus on bringing some standardization, shared definition, shared understanding, shared knowledge, team training on IPS services, provision, how to integrate IPS work into what they're doing. We're feeling more confident about IPS service provision, standardized expectations and metrics, shift from making contact to intentional contact that supports, as people noted, those recovery outcomes. Excellent job, guys. So that is just a quick example of how we can look at individual staff and team-wide challenges, pulling from the data, right? What it looks like for an individual person in service, right, to a staff who's having some patterns or challenges, to team trends. Of course, when we think about this practice, there can be barriers, right? Developing data-informed supervision and data-driven program management leads to hopefully those effective outcome-driven service delivery models. However, this is a change process, and it might include many challenges or barriers. Any barriers that y'all have encountered when attempting to use data-informed supervision? Put in the chat any challenges that you've identified. Anything come to mind? Staff who are not data-driven, not motivated by data. So you're noting, Lauren, that practitioners may have some negative attitudes toward the data tracking process, may not be compelled by it. Um, they may be concerned about micromanagement, accountability, or just disinterested. Maybe administrators undervalue data and database supervision, program planning. Um, or maybe that we don't have the technology in place to do back-end reporting in our ECRs, right? Or we don't have defined processes. That can be a challenge in of itself. Typically, these challenges will fall under three main barriers, categories of barriers: cultural, political, and technical, right? Um, and as a supervisor, it's our role to kind of identify the barrier type and to find solutions accordingly. So when we think about cultural barriers, that could be, beliefs about what matters, beliefs about how decisions should be made, what counts as important, valid information. And so we see cultural barriers might be reliance on anecdotal information, clinical judgment, um, over data, lack of agreement on outcomes, right? What's progress? Data seen as less meaningful than the relationship or the therapeutic alliance. And so that might look like comments like, I know the people that I'm working with, I don't need data to tell me about, what I'm doing. Um, and so when we have cultural issues, supervisors can focus on the alignment of the team on shared definitions of outcomes, giving the clinical reasoning, why to integrate data, building that like rationale, getting people to kind of come alongside. Political barriers might be concerns about how data will be used, um, by leadership, by the system of the organization, right? Fear of punishment, or evaluation, maybe mistrust. Data might be tied to, funding or performance pressure. So that might come up as like, oh, I have low numbers, I'm doing something wrong, right? So how can we reshift that uh, mindset, right? We want to frame data as a learning tool, not surveillance. That's why we don't use raw data. That's why we shift it into information and knowledge, right? We don't want to survey people, um, and use data in supervision, to support the process, right? We don't want to lead it as like a disciplinary measure. Technical barriers, right? Um, might include system, right? The system that we're using, the time, access, right? Limited time, lack of training, poor data systems, no feedback loops. And so that might look like enter data into systems, but we don't use it. I don't know, what certain things mean when I'm entering the data. I can't access it, right? And so our focus in this particular barrier issue is, to teach how to interpret and apply the data, to provide regular feedback, to make things accessible as we can. right? If our electronic system isn't working, how can we use things like the Excel spreadsheets or um, other electronic tracking records, like a Qualtrics survey that gets submitted, weekly, monthly, whatever the frequency is. So key takeaway from this is most data issues are not motivation problems, right? They are challenges with knowing what the meaning is, developing trust, and developing capacity to do this work. And if we come up again with cultural issues, we want to align understanding. If it's political issues, we want to build trust in the process. And if it's technical issues, we need to support building our system, building the system up. I had a whole vignette um, to work on some of the barriers um, in a Google Doc. I'm going to pause the video. I'm going to pull up that Google Doc. Sorry. You guys can take a read of that vignette, and we'll do one. I think I had three. Let's do one vignette, and we could talk about that barrier. Let me pause the recording. All right, so we reviewed our vignette on a political barrier and how to address it with some of those reframes, doing some strength-based supervision, supporting transparency, and building up that rapport, that working alliance again. To recap our session, raw data should be tracked and organized, translated to a meaningful contextual narrative to inform supervision. You are already engaging in data tracking, repurpose the findings to inform your supervision. Tracking is meaningless unless you make it purposeful, translate it into action with continuous quality improvement, and that feedback loop. There will be barriers in making changes, so be prepared. Right? Be prepared. I want to thank everyone for attending today. Please feel free to submit a survey. I'm going to put the link in the chat as well. This survey is for your experience today in today's session. These do get reviewed. They get reviewed by my supervisors. They get reviewed by Washington State to see how folks are experiencing these sessions to inform future sessions. So I am kindly asking that you take a few minutes to complete the survey to give that feedback. We so appreciate it. Any questions from today's session? Please feel free to put that in the chat. I'm having difficulty for whatever reason uploading documents, and I've tried uploading the Excel spreadsheets. I have the PowerPoint slides to upload, so I'm going to let my admin know that documents were not uploading, and they'll get emailed out to everybody. My apologies for that issue. I'm not sure why. It might be the format, the meeting format. I'm going to put that survey link in the chat again. Again, thank you so much for your time, attention, and your participation today. Today's webinar was hosted by DBHR through the Washington Healthcare Authority. Please don't forget to check out our foundational community support newsletters and updates on all things FCS and upcoming trainings. Oh, thank you. I'm going to stop.